This is the Registered Behavior Technician course presented by Shaza Attar. The course content was created by Shaza Attar and is the property of Autism Therapy and Training, Inc. All rights are reserved. This training program is based on the Behavior Analyst Certification Board 2018 RBT Task List 2nd Edition and is designed to meet the 40-hour training requirement for the RBT credential. The program is offered independent of the BACB. Remember, in each class, we will have our active listening, a quiz, and a competency assessment. Welcome back. Today, we'll be discussing the implementation of extinction procedures. Imagine you put $1 into the vending machine to get a bag of chips, but the bag of chips gets stuck in the machine. You begin banging on the machine, but that doesn't work. Then you begin shaking the machine, but that doesn't work either. Now you start shaking it harder and kicking at it. Why do we do this? Well, we want to access the reinforcer, which in this case would be the bag of chips. In the past, putting $1 in the vending machine produced reinforcement, but this time the bag of chips didn't come out and we didn't get the reinforcer. So you start to engage in behaviors to get what you want. If these behaviors worked in the past, then chances are you'll use these behaviors again in the future. What if you don't get what you want? Banging, kicking, shaking the vending machine might have previously resulted in the delivery of the bag of chips. Let's say this time it doesn't. So you bang it, kick it, shake it harder and faster, but nothing. You stop and look at the vending machine. Extinction is a process in which a previously reinforced behavior is no longer reinforced. It is used to decrease a problem behavior. It is when a reinforcer is withheld from a learner. For instance, a child screaming for cookie that usually got a cookie will no longer receive a cookie when they scream. Here's a chart to help you see extinction in a clearer manner. Before extinction, the learner would get the cookie when they engaged in problem behavior. However, when extinction is used, cookie is no longer given. Hazazi and colleagues in 1972 used extinction on an 8-year-old boy that reversed digits when answering math questions. For example, when adding 7 plus 5, he wrote down 21 instead of 12. The function of his behavior was maintained by attention, which was extra help from the teacher. The teacher ignored the incorrect responses and praised the boy for the correct responses only. What are factors that influence extinction? The reinforcement schedule before extinction. If a behavior is on a continuous schedule of reinforcement and placed on extinction, it will decrease more rapidly. A behavior on an intermittent schedule of reinforcement will take longer to decrease because it's resistant to extinction. The other is any occurrence of reinforcement that occurred after extinction. If it occurs during extinction, it will take longer to decrease the behavior. Some misconceptions. Many make the mistake to think that extinction is ignoring the behavior. It's not about ignoring the behavior, but more about you not feeding into the reinforcing consequences that maintain that specific behavior. So here's a chart that shows different functions and the use of extinction. The first one is escape from a task. Initially, the therapist removed the task when they engaged in problem behavior. When extinction was used, the therapist followed through. The next one is the learner receives attention following problem behavior. In the extinction example, the RBT does not turn around to provide any type of attention, even eye contact, when the problem behavior occurs. The next one is the learner gets a toy or a snack following problem behavior. In the extinction example, the therapist would withhold the item. The next one, the learner engages in hand flapping. The extinction procedure may be that the RBT blocks the hand flapping using sensory extinction. And lastly, the learner is scratching their arm repeatedly, and the extinction procedure here could be that the parent puts on lotion on their arms to relieve the discomfort, along with putting on long sleeves to cover their arms. Most often, but not always, an extinction burst may occur. Extinction burst is when the behavior increases by intensity, duration, or frequency. This is when a child begins to hit harder, the behavior intensifies, or when the number of times the behavior occurs. For example, from 5 hits to 25 hits, if we were looking at hitting behavior. So that frequency of behavior increases. So here's a graph that shows the extinction burst. During an extinction procedure, novel behaviors may emerge. The learner may try kicking, then scratching. If those don't work, the learner may try biting and spitting. Aggressive behaviors may occur during this time as well, so they'll try new things to see what will work. Spontaneous recovery is when a behavior returns for a short period of time. It's usually short-lived as long as the procedure stays in effect. It is essential that those implementing an extinction procedure are aware of this so that they don't accidentally reinforce the behavior. Remember, you're putting the behavior on extinction, not the individual. You need to identify what the reinforcer is that you will be withholding. For instance, if the learner is crying for cookie, it's important to withhold the cookies until the behavior stops. Escape behaviors and extinction. You don't want to allow the learner to get away from the task. You don't want to remove the task. You want to follow through with the presentation of the task until they complete it. In practice, during intensive trial training, or DTT, extinction is used on problem behaviors such as off-task behaviors. When a child wants to escape a task, they may look around the room, ignore the RBT, stop responding, and so on. The RBT will have the learner imitate a variety of tasks back to back in a fast-paced, and they might be prompting their hands while doing so. So for example, if they're saying do this, they're prompting them to do it. Once the learner engages in the correct behaviors, the RBT will run about 4 to 5 more imitative skills to ensure that the learner is attending. The behavior of off-task looking around the room is no longer reinforced, and the learner no longer escapes a task by looking around the room. Let's watch this video here. Do this. Say ball.
Ball.
Tell me something that flies in the sky.
A bird.
Do this. Say ma. Do this. Do this. Do this. Do this. Do this. Do this. What is it?
Cow.
Say apple.
Apple.
Show me waving. Good. So what I want you to notice here is I'm going through my high probability cards and I'm teaching my learner. They began to engage in some self-stimulation by engaging in hand flapping. What I did was I went through the extinction procedure. So I did my fast-paced imitation skills. So I had them, let's say, knock on the table, clap their hands, put their arms up, and so on. Now you saw in the initial one, they didn't engage in the behavior, so I actually had to go in hand over hand to show them and to help them. And then my speed is relatively fast. I don't want to go too slow. Do this, do this. I don't want to do that because the slower that I go, the more likely I'm going to lose them. So I need to recapture their attention. And so I'm going to go faster. I also don't want to go too fast. So you kind of have to find that middle balance there. So do this, do this, do this, do this, do this, do this. And that's how it should sound. And I'm going to make sure that I follow through if they don't do it. The reason why I want to do an imitation task is because I can actually follow through with it. If I said to them, say apple, they could just go. You can't make them say anything. But with imitation, you can at least follow through with it. If they didn't clap their hands, I can go in hand over hand and show them the clapping and so on. So and then at the end of that extinction procedure, once she started engaging in the correct behaviors that I was modeling, I went back to my high probability cards. I did 1, 2, or 3, and then I ended my trial there. And then, of course, I could document this if you were tracking extinction procedures at the table and the frequency of them. I would say that that was 1 in that moment. Now, the question is, why do individuals engage in problem behavior when we're in a teaching situation? And there's a nice theory that Vince Carbone had, which is these 3 buttons. And you're looking at the middle button is the button where the learner is producing great responses. They're happy, they're learning, and everything is just going great. They're getting their reinforcers, and everything is just moving so smoothly. Then there's the button where it's the escape button, and that's where the learner is engaging in behaviors where they want to get away from the teaching, environment or teaching table, whatever it may be. And that is when reinforcement is just out of balance. So there's too many demands, and you've got a learner who's engaging in, these problem behaviors at the table to escape. So you really have to look and evaluate the reinforcers that you have and the quality of the reinforcers and the quantity. So if I'm reinforcing every 10th time, that might be too little. So you really want to look at that with your supervisor to say, why are they trying to escape the table? And then there's the other button, which is the button where they engage in self-stimulation because they're just not stimulated enough. And again, they're not stimulated enough, the reinforcers are not high enough, and again, sometimes the demands are just way too high, so the learner starts to engage in self-stimulatory behaviors to stimulate themselves. So you have to look at, can I increase the quality of the reinforcers? Can I engage my learner even more? Can I assess the reinforcers in the beginning and be playful and really capture that learner's motivation and attention prior to teaching? And so when we talked about successful teaching procedures, that's really what our focus was, is let's really establish the reinforcer, let's really capture the learner's attention, and let's go into a really good teaching trial with good prompts, transfer trials, error corrections if needed, and end that trial on a good note. So that's your extinction procedure in a nutshell. Noncompliance is a common issue. You ask someone to do something and they don't want to do it. For instance, an RBT may say, "Stand up," and the learner refuses to stand up. A compliance procedure may be used. This is an extinction procedure which does not allow a learner to escape the instruction. The RBT will follow through by using the same SD over and over until the learner engages in the correct behavior. Here is a video example. Again, always follow protocol based on what your supervisor recommends. So they may not have one for you, and that's fine, but this is something that if you did do it, that's how it would be done. It's a nice fast pace. You're gonna continue doing it until the learner starts engaging in the correct behavior. And once they do, you'll do about 3 or 4, and then you'll go back to whatever it is that you were teaching and end it there. And of course, document it so that you know what's going on for the future. The other procedure that I want to talk about, and that's really more based on the use of negative reinforcement, but at the same time, you really are extinguishing the problem behavior, which is, again, maybe to escape a task. So, for example, if you said to your learner, let's just suppose that we were going to use this pylon again, and I wanted the learner to put the pylon on the table. And this was, let's say it's a skill that we're working on, and all they have to do is put the pylon on the table. But my learner is being non-compliant. They don't want to follow the instructions for whatever reason. Now, again, I always go back to, if you had really powerful reinforcers and a really good relationship and you had instructional control, chances are you wouldn't run into these issues. But let's suppose that you had the pylon and you said to the learner, put the pylon on the table, and they did not follow the instruction and you were using a compliance procedure. So with this behavior, they've learned that if I don't do it, I'll get away with it and I'll escape. So that behavior had been reinforced in the past. But we no longer want to reinforce that behavior. We want to follow through, but we're using a compliance procedure. So this is what it would look like. Put the pylon on the table. 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 Thank you. Good job. We'll just put that there. Okay, great. Now, as you can see, with a compliance procedure, what I'm doing is I'm giving the instructions first. So it was put the pylon on the table. The number one thing here is you got to make sure that your learner understands this instruction. Don't ask them to do something that they don't understand and then do a compliance procedure. That's not fair. I know that this learner can put the pylon on the table. Let's just say that was their reinforcer and I was about to transition into a teaching trial. So I know that they can put the pylon on the table and they understand that instruction. So that's the first thing, is ensuring that your learner understands the skill. The second part to it is I'm going to give them about 3 to 5 seconds to respond. If they don't respond within that time frame, then that's when I'm going to go into my compliance procedure. Again, you do have to follow protocol here. If there is a compliance procedure in place, you have to follow what the timeline is for that. It might be 5 seconds or 10 seconds or whatever is set up there, but that's what we typically do here. 3 to 5 seconds. If the learner does not engage in the correct behavior, then I'm going to continue to repeat my SD until they engage in the behavior. Put the pylon on the table, put the pylon on the table, put the pylon on the table, and so on. It's very repetitive, and so if we go back to that nagging type behavior that we talked about, that's kind of what it is. So now I'm using this approach, but I'm also extinguishing the behavior that I no longer want, which is them escaping the task. So now once they do it, then it ends. I say, all right, great, and we move on from there and we go back to whatever it is that we were supposed to be doing. Again, if you're going to go into a teaching trial in that moment, you really want to be careful, because I just had a compliance procedure. So, problem behavior is already about here. Now, if I put demands, I might now get problem behavior in my next trial. So you want to establish, that relationship once again with your learner, establish some reinforcers, and then go into teaching. And you might do something as simple as a high probability card, such as do this, give me a high five. Great. Almost like a compliance test to make sure that your learner is willing and ready to work with you. And if they show some resistance, then you might say, okay, they're still not ready. What do I do? And again, this is where you reach out to your supervisor and say, I just had a compliance procedure and I did, some high probability, and I'm really not feeling that my learner is ready to work with me. What do I do? And then you guys can brainstorm some thoughts about, is it the reinforcer? Have you been sitting at the table for too long? What else could you do to improve that teaching situation and environment? Another really important thing to note about when we look at problem behaviors and using, procedures such as extinction or compliance or any procedure, or when we're dealing with problem behavior in general, is often when problem behavior occurs, the therapist will then kind of really lighten the load after it. And so the learner starts to learn that when I engage in this problem behavior and, I might do one simple thing, the world just becomes a little easier. They start to just do some high probability cards. Maybe they just play with me. So you want to be attentive to that we don't just lighten the load every time after problem behavior. And again, speak to your supervisor about that, but I'm cautioning you about it so that you're aware of it. Because our learners and clients really pick up on these, and they know that, okay, I've just had that problem behavior. They're going to take it easy on me. So that's perfect. I'll just have another problem behavior. So, again, really watch out for those things when you're working with your learner, and keep the level of teaching at the same level. Obviously, if that's causing a lot of problem behaviors, then you have to go back to your supervisor and say, I don't think we're at that right balance for that learner, and we have to really look at the teaching situation for them. Maybe the demands are too hard, maybe it's too much back-to-back trials, maybe you're not playing enough, and so on. So there's so much analysis, and that's really up to your supervisor to work with you on that. But I think it's really important that you take a look at that as you're working with your learner, because you guys are the frontline staff that see your learners day in and day out. I hope that was helpful, and let's continue. Here's an example in the extinction process. The work is not removed. Before we move on to attention-seeking behaviors and extinction, let's do a Scrabble word. The word is Oka, O-K-A, and this is an Egyptian unit of weight. All right, let's continue. You don't want to give the learner attention such as eye contact, a head turn, or talking to them when they engage in problem behavior when it's maintained by attention. Here's an example. Tommy spits all over the table. His behavior is maintained by attention. The RBT looks away and does not attend to the learner. Once he stops spitting, she counts to 10, then re-engages him. In this example, you could see originally the RBT was saying, "Don't do that." In the extinction process, the RBT said nothing when the learner engaged in the spitting behavior. You don't want to let your learner take their toy or edible or preferred item when engaging in problem behavior. You want to block all access to reinforcers at this time until the behavior has settled down. You want to wait about 10 to 15 seconds before giving the reinforcer, just to have that gap between the problem behavior and the correct response. For example, Tommy is reaching for his cookie and begins screaming for it. The RBT blocks the access to the cookie and waits until the learner stops crying. Here, the cookie is not given in the extinction procedure. In practice, a count and man procedure is used. The problem behavior is placed on extinction. The RBT will say wait, wait, or stop. Once the learner settles down, the RBT counts to 5 and says the target manned. For instance, this is what it could look like. Wait, wait, wait. 1, 2, 3, 4, 5. Cookie. If the learner engages in the problem behavior anytime during that count, then we would restart the count. Counting to 5 helps break that problem behavior and access to reinforcers so that they're not being reinforced, that problem behavior is not being reinforced. This procedure is using extinction as well as functional communication training, which we talked about in one of our previous classes. Blocking sensory consequences, the learner can no longer receive reinforcement from the problem behavior. It is best to find a replacement behavior. For example, Tommy begins spinning around in circles. His behavior is maintained by automatic reinforcement. The RBT blocks him from spinning by holding him. By stopping him, no visual stimulation can occur, and therefore the behavior is placed on extinction. Remember, sensory consequences are stimuli that feel, smell, taste, and sound good, or the movement itself is good. A client engages in these behaviors for those natural occurring consequences. In sensory extinction, you are blocking these consequences. You can stop the self-stimulatory behavior by replacing it with something that serves the same function. Rincover and colleagues in 1978 talked about extinction, and they looked at visual stimulation such as turning lights on and off, waving hands in front of face, tactile such as scratching skin excessively, taste, adding an aversive taste. For instance, a child may throw up and eat his vomit because he likes the taste. As gross as that may sound, lima beans were added to the vomit, which made it not taste as good, so the child ended up stopping from the vomiting. A child engages in arm, wrist, and finger flapping to stimulate muscles, tendons, and joints. A vibrating mechanism was taped to the back of a child's arm to mask these stimulations. Why try to extinguish behaviors maintained by automatic reinforcement? Well, children that engage in automatic reinforcement are sometimes hard to engage socially and difficult to teach. So it's important for us to really get in there and help them out. So punishment versus extinction. Punishment decreases behavior by delivering a consequence that presents an aversive stimulus or removes a pleasant stimulus, and we've talked about this before. Extinction is no longer reinforcing the behavior that was once reinforced. Reinforcement increases behaviors by delivering a consequence that presents a pleasant stimulus or removes an aversive stimulus. And again, if we look at extinction, it's no longer reinforcing that behavior that was once reinforced. So before using an extinction procedure, we want to ask ourselves the following questions. Is the use of extinction safe for the client? For example, using extinction on self-injurious behaviors would not be an ethical choice and could seriously harm the client. We also want to ask ourselves, can the increase of the behavior be tolerated? Extinguishing behavior in a regular classroom. What about aggressive behaviors? What about self-injurious behaviors? Will others imitate those behaviors? Is the reinforcer maintaining the behavior known? Have you been able to identify the reinforcer in maintaining that behavior? For instance, is the child engaging in the behavior to gain access to the reinforcer, like a toy or cookie, or is the child engaging in the behavior for attention? It is crucial to withhold the reinforcer maintaining the behavior in the extinction procedure. Can the reinforcer be withheld? If you're at the grocery store and the child begins engaging in the problematic behavior, could you withhold giving that reinforcer in that moment? Is a replacement behavior being taught? Whether extinction is used, teaching replacement behavior is essential. These alternative behaviors should be reinforced while extinguishing the problematic behavior. You want to use extinction with other procedures, such as differential reinforcement. Depending on the client, you can tell them about the extinction procedure that's going to be used. For example, you might say to them, when you talk loud, I'm not going to answer you. What if aggressive behaviors occur during the extinction procedure? Before I answer that, I want to give you a secret word. Are you ready? The word is gigantology, spelt Gigantology. And this is the study of giants. Again, the word is gigantology. Okay, let's get back into it. So again, what if aggressive behaviors occur during the extinction procedure? This may be things like hitting, kicking, or maybe some verbal lash outs. You want to not react. Do not reinforce those behaviors. However, if it gets to an unsafe point with your client, you or others, you may need to intervene. Intervene with as little interaction as possible, but ensure your safety as well. And always speak to your supervisor about these concerns. Ensure that parents, teachers, and others working with the client are trained on implementing the extinction procedure and are aware of the side effects. Remember, attend to good, desirable behaviors whenever possible. Most often, we attend to problem behaviors because it's loud and it draws most attention. Fading away extinction procedures. Sensory extinction needs to be faded away. For example, a child wearing gloves to block scratching can't wear gloves forever. All right, it's time for the quiz. Then we'll get into my final thoughts. Extinction is A, reinforcing behaviors, B, no longer punishing behaviors, C, a punishment procedure, D, when a previously reinforced behavior is no longer reinforced. The correct response is D, when a previously reinforced behavior is no longer reinforced. An extinction burst, A, always happens, B, increases in frequency, duration, and intensity, C, decreases duration and inter-response time, D, no longer reinforces a previously reinforced behavior. And the correct response is B. The behavior increases in frequency, duration, and intensity. A count and man procedure includes A. Saying wait over and over until the learner is no longer engaging in the problem behavior. B. Counting to 5. C. Labeling the item. Or D. All of these. And the correct response is D. All of these. Which one describes spontaneous recovery? A. Behavior increases by frequency and duration. B. Behavior returns after extinction. C. Behavior does not return after extinction. Or D. Novel behaviors emerge. And the correct response is B. Behaviors return after extinction. Which one describes an extinction burst? A. Behavior increases by frequency and duration. B. Behavior returns after extinction. C. Behavior does not return after extinction. Or D. Some behaviors may occur. And the correct response is A. Behavior increases by frequency and duration. Which one describes an extinction burst? A. Behaviors decreases by frequency and duration. B. Behavior returns after extinction. C. Behavior does not return after extinction. Or D. Novel behaviors emerge. And the correct response is D. Novel behaviors may emerge. Tommy is screaming and reaching for his cookie. The RBT is required to run an extinction procedure. Which one is the correct one? A. The RBT should ignore Tommy. B. The RBT should withhold everything. C. The RBT should not give cookie. Or D. None of these. And the correct response is C. The RBT should not give the cookie. Billy has been screaming to get the RBT's attention. The RBT is required to run an extinction procedure. Which one is correct? A. The RBT should ignore Billy's behavior. B. The RBT should withhold everything. C. The RBT should not give cookie. Or D. None of these. And the correct response is A. The RBT should ignore Billy's behavior. Remember, you're ignoring the problem behavior, not the individual. Sarah talks really loud. The RBT is required to run an extinction procedure on loud talking. Which one is the correct one? A. The RBT should reinforce loud talking and ignore quiet talking. B. The RBT should ignore loud talking and ignore quiet talking. C. The RBT should ignore loud talking and attend to quiet talking. Or D. All of the above. And the correct response is C. The RBT should ignore loud talking and attend to quiet talking. Sam shakes his head during ITT to escape the task. The RBT is required to run an extinction procedure when the behavior occurs. Which one is the correct one? A. The RBT should, in a fast pace, run imitative trials back-to-back until Sam completes 4 to 5 independent trials. B. The RBT should let Sam go, then bring him back to the task. C. The RBT should prompt Sam to complete 2 high-probability tasks, then let him go. Or D. None of these. And the correct response is A. The RBT should, in a fast pace, run imitative trials back-to-back until Sam completes 4 to 5 independent trials. Now remember, even though in this question this is the correct response, it's only correct in this situation. It all depends on what your supervisor has as a procedure for him. So if you were doing an extinction procedure at the table, as I described in the talk, then that would be something that you would use. Your supervisor may have something else using, a type of an extinction procedure, but not exactly the way that I've described. So always follow what your supervisor has in terms of protocols, but this is just for the sake of the quiz and the examples. Spontaneous recovery is when A behavior returns for a short period of time and is usually short-lived as long as the procedure stays in effect. B, new behaviors begin to emerge. C, the old behaviors intersperse with new ones. D, none of the above. And the correct response is A. A behavior returns for a short period of time and is usually short-lived as long as the procedure stays in effect. During ITT, George begins yawning and gazing to the side. The therapist begins modeling a variety of high probability skills back to back in a fast pace. What is the therapist doing? A. Reinforcing the behavior of yawning and gazing. B. Trying to pick up her pace. C. Extinguishing the behavior of yawning and gazing. Or D. None of the above. And the correct response is C. Extinguishing the behavior of yawning and gazing. Hala engages in severe self-injurious behaviors, which have resulted in major head lacerations. These behaviors are maintained by attention. The BCBA decides that the behavior must go on extinction. The BCBA tells everyone to ignore the behavior and not to intervene at all. A. You disagree because you think maybe an antecedent approach could be better. B. You disagree because it's not safe and is unethical. C. You think it's about time that it was ignored. D. You're not sure what to think. And the correct response is B. You disagree because it's not safe and it's unethical. Now, this is, again, when it comes from your BCBA or your supervisor, sometimes we want to just follow our supervisor and go with what they say. But again, that little voice inside of you should say, whoa, no, this is not safe, and we should not be ignoring a behavior that is dangerous like this, because that's where accidents can happen. And these accidents have happened, and lawsuits have occurred. So be aware and speak to your supervisor. Do what you have to do to make sure that these accidents don't happen. Hala engages in severe self-injurious behaviors which have resulted in major head lacerations. These behaviors are maintained by attention. The BCBA decides that the behavior must go on extinction. The BCBA tells everyone to ignore the behavior and not to intervene at all. You disagree and tell the BCBA, a decrease in the behavior is something that cannot be managed. B, an increase in the behavior is something we are prepared to handle. C, an increase in the behavior is not something that would be in the best interest of the client. D, a decrease in the behavior is not in the best interest of the client. And the correct response is C, an increase in the behavior is not something that would be in the best interest of the client. Again, because this could really end up hurting the client, and that would not be an ethical thing to do. Jackie has a 2-year-old that cries each time she puts her in bed. Jackie wants her daughter to sleep independently, so she goes into the room and takes her favorite stuffed animal away. After a few days of this, her daughter never cried at night again. What ABA strategy did Jackie use in an attempt to improve her daughter's behavior? A, reinforcement, B, punishment, C, extinction, or D, antecedent manipulation strategies? And the correct response is B, punishment. She took something away that was a preferred activity, so that would be a punishment procedure. Jackie has a 2-year-old daughter that cries each time she puts her in bed. Jackie wants her daughter to sleep independently, so she lets her cry it out. After a few days of this, her daughter never cried at night again. What ABA strategy did Jackie use in an attempt to improve her daughter's behavior? A. Reinforcement. B. Punishment. C. Extinction. Or D. Antecedent manipulation strategies. And the correct response is C. Extinction. Jackie has a 2-year-old that cries each time she puts her in bed. Jackie wants her daughter to sleep independently, so she turned on a night light before she put her in her room alone. After a few days of this, her daughter never cried at night again. What ABA strategy did Jackie use in an attempt to improve her daughter's behavior? A. Reinforcement. B. Punishment. C. Extinction. Or D. Antecedent manipulation strategies. And the correct response is D. Antecedent manipulation strategies. She put the night light in before the problem behavior occurred, so she manipulated the environment to reduce her problem behavior, which was effective. Way to go. Jackie has a 2-year-old daughter that cries each time she puts her in bed. Jackie wants her daughter to sleep independently, so she picked her up and rocked her to sleep. Each night, she continued to cry. What ABA strategy did Jackie use in an attempt to improve her daughter's behavior? Or did it improve? A. Reinforcement. B. Punishment. C. Extinction. Or D. Antecedent manipulation strategies. And if you said A, reinforcement, you're absolutely right. So each time that her daughter cried, she reinforced the problem behavior. She probably did end up going to sleep, but maybe not independently. So I'm not sure if that really helped out, but that was a tricky one, hopefully, for you guys. But these examples are given so that you can really see reinforcement, punishment, and extinction and antecedent manipulation strategies used so that when you do the final exam, you're prepared and you can see which one is which, and you're able to discriminate and distinguish between them. Mike's son bangs his head on hard surfaces. The BCBA on the team determined that the behavior is maintained by automatic positive reinforcement and places a helmet on his head. What ABA strategy did the BCBA use in an attempt to improve the behavior? A. Reinforcement. B. Punishment. C. Extinction. Or D. All of the above. And the correct response is C. Extinction. Mike's son bangs his head on hard surfaces. The BCBA on the team determined that the behavior is maintained by attention. His parents would hug him and calm him down. The BCBA decided to have everyone give Mike's son high fives every 30 seconds and to be sure not to give him a hug when the behavior occurred, but rather put him in the timeout chair. What ABA strategy did the BCBA use in an attempt to improve the behavior? A. Reinforcement. B. Punishment. C. Extinction. Or D. All of the above. And the correct response is D. All of the above. John throws toys when he doesn't get access to his reinforcers. His teacher created a booklet of his most preferred reinforcers and left it on the table and taught John to touch the picture. Once he touched the picture of the toy, she would give it to him. He is no longer throwing toys. What ABA strategy did the teacher use in an attempt to improve the behavior? A. Reinforcement. B. Punishment. C. Extinction. Or D. Antecedent manipulation strategy. And the correct response is D. Antecedent manipulation strategy. Laura is trying to lose weight. Every time she craves chocolate, she pulls a rubber band on her wrist, delivering a painful sting. She no longer eats chocolates and her cravings have decreased. What ABA strategy did she use in an attempt to improve the behavior? A. Reinforcement. B. Punishment. C. Extinction. Or D. Antecedent manipulation strategy. And the correct response is B. Punishment. Way to go. Muhammad's friend calls him 10 times a day to complain about his problems. These calls can last up to 2 hours, and Muhammad just doesn't have that kind of time. So the next time his friend called, Muhammad ignored the call. After 3 days of this, his friend never called back. What ABA strategy did Muhammad use in an attempt to improve the behavior? A. Reinforcement. B. Punishment. C. Extinction. Or D. Antecedent manipulation strategy. And the correct response is C. Extinction. Omar throws toys when he is bored at the daycare. His ECE teacher noticed that he doesn't explore the room, so she placed 3 toy bins in front of him on the floor where he sits and rotated the bins every 15 minutes. He's no longer throwing toys. What ABA strategy did the teacher use in an attempt to improve the behavior? A. Reinforcement. B. Punishment. C. Extinction. Or D. Antecedent manipulation strategy. And the correct response is D. Antecedent manipulation strategy. May throws toys and looks up at her grandma. Her grandma sits beside her and says, "May, you don't throw toys. It makes me so sad. Let me show you how to play." What do you think will happen to the behavior since it appears to be maintained by attention? A. Increase. B. Decrease. C. Nothing. Or D. Hard to say. And the correct response is A. It most likely will increase if it's maintained by attention. Muhammad's friend calls him 10 times a day to complain about his problems. These calls can last up to 2 hours, and Muhammad just doesn't have that kind of time. So the next time his friend called, Muhammad ignored the call. His friend started calling 15 times on the first day, then 25 times on the next day, and 40 times on the third day. After 3 days of this, his friend never called back. The increase in his friend's behavior is known as the A. Reality of life. B. Spontaneous recovery. C. Extinction. Or D. Extinction burst. And the correct response is D. Extinction burst, but it's probably also the reality of life. My final thoughts. Extinction is a very powerful ABA principle. It's one that can be used to deal with so many behaviors. Just as any principle in ABA used, we need to really look at the outcome of the procedure and the effects on the individual. Can we even run it? For example, I was once running an extinction procedure with a little boy. I asked him to clean up and repeated the SD over and over. The goal was that he would eventually clean it up. His mother was in the room and was aware of the procedure. After about 3 minutes of watching this, she couldn't handle it anymore and walked over to him and said, "Would you just clean it up?" Sometimes an extinction procedure cannot be used because those may not be able to follow through with it or even tolerate it. Using the example of parents that let their children cry to sleep, some parents may not be able to handle the sound of the cry and will end up reinforcing the behavior. These are important to know when using these kinds of procedures. Something to talk about with your team and your supervisor. Thank you for joining me today, and I'll see you next time.